Hey, hello, Jeanice. Thank you so much to be here in our conversation, our talks with specialists. It's very nice to have you here. I am fan of your work. I follow you in Instagram since the beginning, and you are doing a great job. Thank you so much because it's very important. We're talking before, and I worked with pelvic floor muscles since I was in the university, and it's very important to share what you do because most of women don't know they can have physiotherapists for pelvic floor dysfunction. So thank you so much. You are doing a very great job.
Oh, thank you. I really appreciate the opportunity to be here with you today, Laira. Thank you for your support, and for anyone that is watching this or joining, I hope that this information will help to make the pelvic floor muscles fun and help you to understand a little bit more about how to train your pelvic floor muscles and to learn some little tips for them.
So we can start.
All right, let's just jump into it. So before we get started, here's a little bit of an outline. Can you see my cursor okay?
Yes, I can see.
Okay, so we'll go over, this is the outline for what we're doing today. We'll talk about where the muscles are and what they do and how they work and when things go wrong and some tips for you. But you know what, before we even start on all that, I just want to give you a little bit of my background. So I am a pelvic health physical therapist and I'm in Central Texas. I graduated from Loma Linda University in California in 1995. And I worked in an outpatient orthopedic setting for about 5 years. And then I had my first baby in 1999. And I had problems after my baby was born. And so I saw a little ad at that time, an advertisement in a magazine for a class, a pelvic floor class. And so I said, I want to go to learn for myself. I didn't want to put my finger in people's vagina or their rectum. I thought, I just want to understand this information for myself so I can help myself. But when I went to the class, it was amazing. And I knew that this is what I wanted to do, to be able to share this powerful information with other people. So that's been my journey for the last 20 years. And I love what I do. And I hope that you learn to love your pelvic floor muscles and understand how they work and so forth. If you have any questions as we're going, feel free to jump in and let me know. Okay, so I'm a physical therapist, but I'm not your physical therapist. So this isn't medical advice for you. And I always recommend that you get evaluated by a qualified healthcare provider wherever you are. Okay, so this is information that's to help you increase your awareness and understand how your body works. Okay. So some of these conditions here, these are red flags, which means if you have these, you need to get checked out before you start a program on your own. So unexplained bleeding or pain, trauma, a fever, chills, night sweats, unexplained weight loss, unexplained weight gain, altered mental status, which means basically you're kind of confused. You're not oriented to time and place and person. Depression or suicidal thoughts. So if you have any of those, get checked out by a healthcare provider and make sure that nothing else is going on. Okay, so here we go. We'll jump right into the anatomy. This is the female, and she's cut in half. So if you could see me like cut in half, and you're looking at the inside of my internal organs. So here is the belly in the front, and this is the buttocks and the tailbone and the spine here in the back. Here is the bladder, and the bladder has a canal for the urine to exit called the urethral canal. Okay, so the bladder is kind of like a balloon, and when it fills up with urine, it expands. And then when you empty the urine, this is where the pee comes out. Here is the uterus, and it's connected to the vaginal canal. So this is for sex and childbirth. And then we have the rectum. So this is for poop and gas, and this is the rectal canal. All right, and then this beautiful little structure here is the clitoris. So this is only just a small representation of the clitoris, because the clitoris actually has much more involved, but this, we're just showing you a little piece of the clitoris here. And then this is the pelvic floor. So the pelvic floor muscles attach at the pubic bone and then stretch all the way back to the tailbone, kind of like a hammock in your pelvis or a basket. All right, and then this is the vulva. So if you have any questions, just let me know. Now let's watch the pelvic floor muscles contract. Okay, so you see they're contracting, and those canals, our 3 canals there, close. So that's what's meant to happen. When we contract, those canals close, and then we relax and the canals open up again. So let's go through that animation one more time. So you can see the muscles start to contract and they lift up and they close those organs, and then they relax and the canals open. Here is a view from below of a female. Okay, so basically this is if you were looking at someone at their feet and you were looking into their bottom. This is the bottom view. So this is the pubic bone, and here are the thighs. This is the right thigh and the left thigh and the buttocks here. This is the clitoral hood. So the clitoris has like a little hood that covers it up to help protect it like that. And then you have the glans clitoris. And here is the opening for the urethra. So remember that canal that we just talked about where the urine exits? So that's the urethral canal. This is the vaginal opening. And then this is the rectum. And here you have the labia. So you have the outer lips, which are the labia majora here. And then you have the inner lips, which is the labia minora. This structure right here in between the vaginal opening and the anus, this is called the perineal body. And this is a very important structure, especially if you've had a vaginal delivery. This is typically where tears or an episiotomy would happen in this area. Okay, so now we're looking at the same view, but we took out the outer layer and now we're looking at the inside. So many times people think that their pelvic floor is just one muscle. They think it's just one Kegel muscle, that just one little baby muscle that you squeeze. But look at all of this. These are all your pelvic floor muscles. You have muscles here, you have muscles here, you have muscles here, and then you have a superficial layer and you have a deep layer. You have muscles that wrap around the anus here, they wrap around the urethra and the vagina. And you look here, even some of these muscles attach right there to the clitoris. So that is a very important key to remember. And then you have muscles that attach here to the tailbone as well. So, oh, and then also look side to side. So remember our hammock, it stretches front to back and then side to side. So literally it's like a basket. The muscles are named perfectly. Pelvic floor muscles. So those muscles are the floor, literally the floor of your pelvis to hold up the organs. And they have several jobs. So here, let's watch a pelvic floor muscle contraction. So you can see when the contraction comes in, the muscles are pulling up and in. Let's watch it again. Those openings are closing. You can see the perineal body here kind of tighten and pull up and in. Even the tailbone moves. So let's watch that again. See how the tailbone is kind of pulling. It probably doesn't really move this much in real life, but this is a little bit of an exaggeration to show you what the pelvic floor muscles do. And I love this animation, so we're just going to watch it again. So watch the anus. So you see the anus kind of pucker up and in. Watch the vaginal opening. You see the vaginal opening close and draw up and in. And watch Let's watch we're going to watch the urethra there. So here it is, it closes and it lifts up and in. So it's a pretty cool group of muscles. Depending on how you count, there's at least 17 muscles that make up the pelvic floor. So it's not just one little muscle down there. You have multiple muscles and multiple layers, and each muscle has a different job. We're not going to go into all of the specific jobs of each muscle in this presentation, but I think the takeaway message is that you have multiple muscles that have many different jobs to help your pelvic floor and pelvic health function. Okay, so pelvic floor recovery. So when you have a baby, let's see, I think I like this. I'm missing one slide, I think, or it might have gotten out of order. So when you have a baby, let's just go back to this slide here. When you have a baby, the baby comes out of the vaginal opening, right? That's one way, or you have a cesarean section. And so those muscles get stretched. And here is the information. So they stretch from 1.62 to 3.78 times their resting length. So think about your bicep muscle. If your bicep muscle stretched almost 4 times its resting length, you would have a very, very long bicep muscle, and it probably would rupture. It probably wouldn't have the elasticity to be able to stretch that much. So your pelvic floor muscles are very, very unique in that they're closed, right, most of the time, but they have the ability to open and stretch to allow that baby to come out up to 3.78 times their resting length. Then so many times people think, oh, well, I had a baby, but it was no big deal. I can start exercising and doing everything that I want to do next week. No, our bodies need time to recover. So it takes the majority of people, the majority of recovery will happen within the first 6 months postpartum. And then by 12 months, the pelvic floor muscles resemble those immediately after cesarean section. So just because you had a C-section doesn't mean your pelvic floor muscles weren't affected. They were, and it takes time to heal for vaginal delivery and a cesarean section. So just keeping those things in mind. Now, when you have a baby, so this is a little sketch of the pelvic floor. So here's the anus. That's the vaginal opening. That's the urethra opening. Here's the clitoris. These are the outer lips and the inner lips, okay? And here is the perineal body. So here's what we call a first-degree laceration. So it's just a small tear, and that usually takes a few days up to a few weeks to heal, but that's the least severe. And usually with this type, the pelvic floor muscles aren't torn or cut. But man, I'm missing another slide. Oh, I'm so sorry. I missed my second degree. I missed my second degree. Well, there's a second degree laceration. And so a second degree goes further. And with a second degree laceration, the pelvic floor muscles are torn. And so remember, you have superficial and deeper layers of pelvic floor muscles. So with the second degree, the pelvic floor muscles are torn. And so it's going to take longer to heal. And it's important to understand that you need to allow your body time to heal and recover and support those pelvic floor muscles. Now here we are with the third degree laceration, okay? And so here's the vaginal opening and here's the anus. And with the third degree, it goes all the way to the anus. And so it's a deeper tear, and sometimes even the muscles here of the anus are affected. So this takes a lot more recovery time, and you know, your birth provider needs to stitch you up, and sometimes that's done in an operating room under general anesthesia. And then we have the fourth degree laceration. So this goes all the way into the anus and into the rectal canal. So we want to avoid, if at all possible, third and fourth degree lacerations, because that is a really big impact to your pelvic floor and your muscle function. you had a baby, or maybe you didn't have a baby, but you're ready to start training your pelvic floor muscles. So I like to break the training into 4 different phases, and we're going to go through each phase individually. But the first phase is identify. So how are you going to train muscles if you don't even know where they are? Many people don't have a good connection with their pelvic floor. So they may have heard about their pelvic floor, they may not have heard about their pelvic floor, but even if they've heard the words, there's been research to show that when people try to squeeze their pelvic floor and they think they're squeezing, a lot of people aren't. Even up to half of people, even with instruction, aren't squeezing the right muscles, or they're compensating or doing something wrong. So identifying where your pelvic floor muscles are and then isolating them. So kind of using your quadriceps in your leg muscles, that's your big thigh muscle. If someone had a knee injury and they had weakness in their quadricep muscles, would we send them back to running right away? No, we're going to train their we're going to train their quadricep muscle. We're going to isolate the muscles. We're going to start with some slow, gentle exercises and then gradually build up. But it's very important that we're isolating the muscles that are weak to start off with. And then once you isolate and you're not doing other compensatory things, then you're improving them. So if they're weak and underactive, we're strengthening them. If they're overactive, we're teaching them to relax and be healthy, and work on down training. And then, you know, it's very individual based on someone's function. So that's why it's important to work with a pelvic therapist to identify your function and help you with a training program. And then lastly is to integrate. So going back to the example of someone that had a knee injury and their quadricep or thigh muscles were weak, would we keep them lying down doing a gentle exercise forever? No, we want them to be able to run again and jump again and play football again, or whatever activity they want to get back to. So the same thing with integrate. It's good to isolate and to strengthen and to retrain, but we've got to integrate that into functional activity and help people return to doing what they love. Sometimes we have to modify things, and sometimes it's a gradual process to get there, but with the right training and tools, most people can return to doing what they love. All right, so there's different ways to identify your pelvic floor muscles. I've listed 7 different ones here, and we're going to go over the different ones. Okay, so you can see here's the pelvis, and that's the anus, that is the vaginal opening, and the urethral opening. So basically putting your finger on your anus and practicing squeezing up and in. So that's one way that a lot of people find is an effective way to understand where their pelvic floor muscles are. Using a mirror to look. So put either like a little handheld mirror, or some people even use their phones with the flip around function. And so look at your pelvic floor and kind of separate the labia and squeeze up and in. When you squeeze, does the anus kind of pucker up? Do the openings close, or do you see it pushing out towards you? So like if you saw the anus open, that means you're doing it wrong. So when you squeeze, that anus should kind of pucker up and in. Another way is to sit on your hands. So basically kind of make your hands like a C, and this one you can do with your clothes on. These other 2 you needed to do with your clothes off, but this one you can do with your clothes on. So kind of sit on your hands, and when you sit on your hands, you have something called sit bones. So kind of put your fingertips on the inside of those sit bones. So if you can see on this image right here, here are the sit bones, and we're kind of pushing our fingertips up and in. And in that position, try to squeeze, try to lift up. And what is the ideal is for you to feel those muscles kind of lift away from your fingertips. All right. Another way is to put your finger on your tailbone. So remember in that animation where we saw that the pelvic floor muscles attach to the tailbone and the tailbone actually moves a little bit when you squeeze your pelvic floor muscles? Sometimes people find that that's an effective way to find their pelvic floor muscles. Urine stop test. So basically what this is when you're going to the bathroom and you're urinating, you try to stop the flow of urine. Are you able to stop it completely? Are you able to slow it down? Does nothing happen? Now, this is not something that you want to do on a regular basis because you have reflexes in your body that are meant to empty the bladder. And so if you're always trying to squeeze when that bladder is trying to empty, that can confuse your body and that can create some other problems. So this is only, I generally say, just use this right at the beginning to help find your pelvic floor muscles, or if you want to check it once every 30 days or something. Occasionally, it's not a big deal, but if you're in a habit of doing this and you're disrupting your internal reflexes or your bladder emptying reflexes, then that can be a problem. So if you have pain, I wouldn't use this one at all, or if you have any bladder infections or urinary tract infections. But for some people, this is an effective way. And ultimately, we want our muscles to be strong enough so that if we're in the middle of urination and something urgent happens and we have to stop the flow, that we could stop the flow if we needed to. And then the next one is finger on or in the vagina. So again, here we are from below and the finger is right there at the vaginal opening. So you can put it outside that opening, and when you squeeze, does it kind of lift up and in? Or you can even put your finger inside the vaginal opening. And if it's inside, do you feel the muscles kind of close and lift? That's the goal for you to feel. And the last way that I have here that you can find your pelvic floor muscles or identify them is to sing. So when you sing, I want you to try this. So if you're watching this, I want you to go ahead and sit on your hands. So I'm going to do it too. Like you have your, unfortunately, you can't see what I'm doing, but I'm sitting on my pelvis and my fingers are right inside my sit bones and they're kind of pushing up and in, okay? And so I want you to try this, and you can try it on your own after the webinar is over too, but do this. And when you do, your pelvic floor muscles should kind of lift up and in, okay? And then if you say grrr or shh, like a deeper bass, those pelvic floor muscles kind of drop and relax. So that's another kind of fun way that you can identify your pelvic floor muscles. Okay, next is to isolate. So again, remember, like we talked about with the quadricep and the thigh and the knee injury, we need to train. I'm going to read this quote here by Dr. Carrie Bow, who is a world-renowned researcher and pelvic physical therapist. And she's my hero. I've never met her in person, but I would love to someday. So
she's amazing. She's very nice.
Is she very nice? Oh,
yes, I had a meeting with her and I talked to her in Oslo once, and she's very nice, very nice.
Oh, good. Yes, yes. She seems like a lovely person, and she's done so much in the world of pelvic health. So, so this is one of her quotes. Most importantly, to train and build up a muscle or muscle strength and volume, it is mandatory to work specifically with the targeted muscle, okay? So isolating is very important. Now, the pelvic floor muscles do several things. So they need to correctly contract and completely let go. And I like to use my hands as an example, but if you remember that animation that we went through several times at the beginning, when you contract, the pelvic floor muscles close and lift. So they close those openings and they lift. So that's a correct contraction. And then when you're letting go, the pelvic floor muscles need to open and lower. So they open and lower. Pelvic floor muscle training improves. So we just talked about correctly contract and completely letting go, but now we need to do it at the right time. So there's some times that we want the pelvic floor muscles to be active. And when I say active, I mean contracted. Okay, so what might that look like? When would we want the pelvic floor muscles to be active? Some examples of that would be when we are coughing or jumping or laughing. We want those pelvic floor muscles to close around the bladder outlet so that urine doesn't leak out, or bowel stool doesn't leak out, or gas doesn't leak out, right? Another time when we want them to be active would be when we are walking or lifting or running. We want those pelvic floor muscles that are at the floor to lift against gravity and the organs. So let's imagine that this is the pelvic floor and here's the bladder and you're running. And so running, running, running. So the pelvic floor muscles are kind of like a trampoline. So the organs bounce down, but the pelvic floor muscles lift back up. So we want to have the stiffness in the pelvic floor muscles to support, but it also needs to give a little bit and come back up. Give a little bit and come back up. So that's being active at the right times. Another time when we might want the pelvic floor muscles to be active is during sex or during penetrative intercourse. So sometimes it feels really good to squeeze the vaginal canal and to squeeze those pelvic floor muscles. It helps to increase tone. It helps to increase sensation for you and your partner. And the pelvic floor muscles also automatically contract during orgasm. So when you have an orgasm, your pelvic floor muscles are like, zzz, 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 and you're not actively thinking, oh, let me squeeze my pelvic floor muscles. Although sometimes squeezing your pelvic floor muscles during orgasm, sometimes that can even make the orgasm stronger. So there's no guarantees there, but that's one opportunity there, one possibility. And then relaxed at the right time. So let's talk about urination again, or the bladder. So when you go to urinate, do we want the pelvic floor muscles closed off and tight? No, we want the pelvic floor muscles to relax and open so that the urine comes out. Or when you go to have a bowel movement, do you want the pelvic floor muscles tight and you're having to strain and push? No, you want the pelvic floor muscles to relax so that sphincter opens and the poop can just slide right on out. And then the same thing with gas. So we want the pelvic floor muscles to be able to relax to pass gas. And one other piece here is with sex. So we want the pelvic floor muscles to have the length and the coordination so that penetration isn't painful. So here's a pretend vaginal opening again. And here are pelvic floor muscles that are closed off and tight. We want those muscles to be able to relax and lengthen so that penetration, like that, can you see it okay? So that penetration isn't painful. If the pelvic floor muscles are closed and tight like that, penetration can be very painful or sometimes even impossible. So that's another example. There are many, many different ways to improve. So if I've listed them here, there's a lot that goes into training, and so that's where it's important. If you're having problems like leakage or pain or prolapse or heaviness, it's important to work with a therapist to help identify what your baseline function is and then give you some tools and some tips for retraining. But basically we can up train, we can down train, we work on coordination training, we even put our hands on the muscles to help train them. We do functional training, technology assisted training like with biofeedback or with ultrasound, electrical stimulation, and more. And then there's different factors to improve. So we want to look at the strength. So many times people think when they do a Kegel exercise, oh, let me just squeeze a little Kegel. To really build strength, you need a maximum voluntary contraction. That's what we call it, MVC. So let's use your bicep as an example. If you're trying to build strength in your bicep, are you going to just are you going to just kind of go to the gym and do this up and down? Or are you going to add weight? Are you going to work hard? Are you going to push that muscle to work hard? So to really build strength, you need to push the muscle. And so that's what maximum voluntary contraction is. Muscle volume. So research is showing that you can hypertrophy the pelvic floor muscles. Hypertrophy basically means to build volume or to make it bigger and thicker. So the pelvic floor muscles with training can get stronger, bigger, and thicker. And then as they're getting stronger, bigger, and thicker, we want that tension. Remember that trampoline? We want that tension to be there, because if you don't have the tension on that trampoline and you're running or you're doing some kind of activity, when those organs fall on the pelvic floor, it's going to kind of drop. And that eventually can even lead to pelvic organ prolapse, where you have the bladder or the uterus or the rectum kind of collapsing into the vaginal canal. And depending on the level of prolapse, it can even have a bulge outside of the vaginal canal. So that's a whole other presentation on its own, but that's a little bit about what pelvic organ prolapse is. We want to work on coordination. So again, doing the right thing at the right time, posture, endurance, and more. So that's kind of a summary of it. Anything you want me to cover there, Laira, that I didn't?
No, that's perfect.
Okay, great. And then the last one here is to integrate. Okay, so remember we talked about with the injury to the knee and the thigh muscle, the quads. You're gradually isolating and building strength, and then it's time to start doing activity. So if you're having leakage or pain or prolapse or pressure, we want to train those muscles to do the right thing at the right time with activity. And that will look very, very specific based on what your function is and how your history, you know, did you just have a baby 2 weeks ago? Well, we're going to be working more on the isolation and on the building up of the strength and supporting the pelvic floor muscles, and then gradually working to integrating you back into your activities that you want to return to. There are some common mistakes that a lot of people make with pelvic floor muscle training. So I've included some of the most common mistakes that I see. Number one is holding your breath. Most people, when I say squeeze your pelvic floor or pull up and in, they're holding their breath. So please don't hold your breath. We're working on training the pelvic floor muscles to be able to activate with your breathing. So we want to coordinate it with your breathing. Another mistake is that you think you're doing it right. So many people think they're doing it right, but a lot of them aren't doing it right. So going back to that identify slide and understanding how you can check, and if you're not sure, go to somebody that can help you. Pushing down instead of pulling up and in. So when you squeeze, are you really pushing out? And that is that can actually create worse problems because you're straining the pelvic floor potentially, especially if you're holding your breath. So check yourself out or get yourself checked out to make sure you're doing it right. Another one is only working on quick squeezes. So basically, when you squeeze, good, it's good to do quick squeezes, but we also want to do endurance squeezes. So how long can you hold? Can you hold 5 seconds? Can you hold 10 seconds and keep breathing? Can you hold 20 seconds? And I like to start my patients with depending on where they are in their function and so forth, but a lot of times it's easier to put the pelvis above the heart to start with, because that's allowing gravity to kind of help, and that's an easier position, and then you gradually change to different positions. But working on quick squeezes, basically you're only working one element of the pelvic floor function. And we want to work on strength and endurance training, like we talked about, that maximum voluntary contraction, and being able to hold it up over time. Choosing the wrong starting position. So again, depending on where you are in your recovery process or where you are in your function, sometimes people need to start with their hips above their heart to help, to let gravity kind of help. And then you progress to gravity neutral, which would be lying down. And then you progress to sitting and standing and functional activities. So depending on your function, you know, you start anywhere and then you gradually progress. Squeezing accessory muscles when trying to isolate. So this is another very common problem that we see. I will say, okay, let's squeeze your pelvic floor, and I see them squeezing their buttock muscles, or I see them squeezing their inner thigh muscles, or I see people curling their toes. So we want to try to turn off those other muscles to start with, and then as you're progressing, then integrate those muscles into your training. And then lastly here we have not completely letting go. And this is, I think, a very common problem in our very fast-paced lives. We're so busy, we're doing things all the time, and we think that squeezing is the answer to every problem, but it's not. A lot of times we need to learn to let go, train our muscles to let go, and then you actually get a better contraction. So think about your hand. And if your hand was squeezing all day long like this, when you needed to go use a pen to write, or you need to help use a knife to chop vegetables for dinner, or whatever you're doing, if you're constantly squeezing, it's going to be much more difficult to use that. And over time, you're going to have muscle tightness, you're going to have soft tissue tightness, the blood flow isn't as good to that area, and sometimes you can even have nerve compression. So we don't want to go around all day squeezing and tightening. We do want to squeeze and tighten, but we also want to let go and completely relax and train both phases. Okay, so here's a little handout of common mistakes and how to correct them. So we've talked about some of these already. And if you want this handout, you can go to mypfm.com, and it's a free download. So you'll, after about 5 seconds, I think, when you're on the website, it pops up and you just put your email address in, and then it gives you the download. So this is a nice little tool that you can use, or if you're a provider, you can print it out and give it to your patients as well. So a common mistake is squeezing the wrong muscles. How to correct that is to identify and isolate the pelvic floor muscles to start training. A mistake is straining, holding, or pushing down. Like we said, breathe and lift the floor up, closing the openings. Squeezing extra muscles. Keep the hips, buttocks, and legs quiet. Wrong starting position. So again, like if you're weak, you want to start in a gravity-assisted position. Or if you're strong, then exercise against gravity. Another mistake would be performing in isolation only. So we don't want to just do Kegels lying down forever. We want to progress to activity. And then practicing quick flicks only. Make sure you practice these quick flicks, but also work on endurance and coordination and being able to let go completely. Okay, so it's very important that you know how to find help too. So at mypfm.com, we have a lot of free resources on our website, and there's something called Find a PT, and you can go to that link and it takes you to 4 free searchable databases. So there's some that are more based in the US and there's some that are more global, and you can enter where you live and you can see where to find a pelvic therapist near you. And if you're a pelvic therapist, I encourage you to sign up there as well so that you're included in those global databases. Laira, do you have a database that you recommend in Portugal that is effective at finding a pelvic therapist?
Unfortunately, I don't have here. We have a group, woman physiotherapist in our association, Physiotherapist Association, and maybe you can find some there.
That's good. And
but you to have physiotherapists from Portugal and from Brazil, your website would be great. I can do that.
Yes, so I think that the two directories that would probably be the most global would be the GFAM and the Flower Empowered. But if you have any questions or you have problems finding one, let me know. You can direct message me on Instagram. I don't think I even have my Instagram channel on here, but it's My Pelvic Floor Muscles on Instagram, or you can go to mypfm.com and you can send me a message that way. Okay, so let's say that you find a physical therapist and you've made an appointment and you're going to go. Now what? So here's some great questions to ask your pelvic physical therapist. So number one is my status. So what did you find out in my pelvic therapy assessment? What is the source of my symptoms? You don't have to ask all of these questions, but it gives you, I think, a baseline of some things that most pelvic physical therapists will be looking at, and it helps you, I think, to be able to understand the process a little bit. So my goals, do you think I will be able to achieve blank with pelvic physical therapy? So is that returning to running? Is it lifting your baby without pain? Is it having an orgasm during intercourse, or whatever it is? So if you have things that are not functioning the way that you want them to with your pelvic floor and your pelvic health, tell your therapist, and then you make goals together. Mechanism of injury. So why did my symptoms start? You know, what is the cause? Which muscles are involved? Are they overactive? Are they underactive? Weak, or a combination? My timeline. So how long do you think it will take? My pelvic therapy plan. What interventions do you recommend? My therapy team. So do you have experience with this? Will you be the one performing my therapy, or will I see someone else? My home program, what do I need to do at home and how often? My equipment, is there any equipment you recommend I purchase? And then my healthcare team, are there any other providers that you recommend I see? So of course you can ask more questions than this, but this gives you a starting point to help communicate with your pelvic therapist. Okay, I have a couple little questions that people gave that I'm going to give you here. So I have a hypotonic pelvic floor. So hypotonic means that it's kind of weak and stretched out. It's not very active. So I was wondering if you have any thoughts on any of these pelvic trainers. I know traditional therapy works. However, there are times I'm questioning if I'm doing enough. I currently don't have time to seek out a pelvic floor physical therapist, being that I work 8 to 5. So I love technology and how it can help us to follow through and train at home. So pelvic trainers, especially those that are either giving you like with an app or a screen where you can see what you're doing, I think they're very helpful, or they can be helpful. But the key is that your pelvic floor muscles are doing the right thing at the right time. So are you able to squeeze? Are you correctly contracting? Are you completely letting go? So my recommendation here would be go to see a pelvic therapist and make sure that you're doing things correctly. And then they can recommend a home unit for you specifically. And then you work on that unit, and then you have them to follow up with maybe every month or so. And at the beginning, it might be every couple weeks, but you have that relationship with that pelvic therapist, and you have a guided plan for home. Okay, I scrolled through your feed, but I couldn't find anything about a descending perineum. Maybe other women would like to know too if that's common after giving birth and how long it takes to heal. Nightmare for me to go number 2. So basically a descending perineum or a pelvic floor is basically where that trampoline is kind of lax. And if you remember that slide, most of the recovery happens after birth within 6 months, but it can take up to 12 months even for your muscles to return to what they are with a C-section, immediately after a C-section. So it's a very common thing to have laxity and to have, you know, it's taking time for your pelvic floor muscles to recover. They've been through pregnancy and labor and delivery, and remember how much they had to stretch, and maybe they got torn or they got cut because to deliver the baby safely. So basically, it's very common. I recommend support postpartum, and I have some posts and content on that, but basically helping to support from below. So like some supportive shorts or some supportive underwear. They have something called EVB shorts. So it's at evbsports.com. There's also some external devices, kind of like a jock strap that you can wear on the outside. So I think in this, it might be helpful to include some pictures next time. So basically, research shows by 6 months, the majority of the recovery has happened. And remember, pelvic floor muscle training. So we talked about some support options there, and we want to train that pelvic floor to lift up and in and to support. Okay. So that is the end of my my slides here.
Hello,
I'm back.
thing.
Yes, yes. So I hope that information was helpful and it gives you some structure, because sometimes people hear pelvic floor muscle training and it can be overwhelming kind of to know where to start. So that gives you kind of a path of where to go, and I hope that it's helpful information.
Something very, very interesting to me. It's when I tell someone what I do. Wow, what is that? With kind of muscles, and I need to explain everything again. Is it happening to you as well?
Oh, yes. I feel like most people, and you know, it's getting better, I think, with social media. But when I meet people out, non-social media people, I would say very few people have heard of their pelvic floor or what it does. And most people don't understand it.
Do they also tell you, but I am a man, I don't need it, I don't have it? Oh, you
yes. Oh, yes, I'm fine. I'm fine. Well, and then I'll say, well, maybe you're fine right now, but you might have problems later. So it's good to understand your anatomy. And even if you never have problems, you're going to know someone that has a problem. And so just by understanding how your body works, you can give someone hope, and you can say, hey, there's therapy for that, you know?
Yeah. And I have some question for you. We used to have
Yes.
I promise I do this in 10 minutes.
Yes, yes.
So, don't you think it's a little danger when they start to do their exercise without see a physiotherapist one time? Because sometimes they cannot understand their muscles and they can do the exercise in the wrong way. How can you be sure they're doing this in the right way at home?
Yeah, there's really no way that I can be sure. So the gold standard is for everyone to be able to see a pelvic physical therapist, right? But there's going to be people all over the world that will never see a physical therapist. Maybe because it's finances. Maybe they don't have the money to. Maybe it's social. There's social taboo, or you know, maybe it's access. So there's still people in countries that don't have physical therapists, especially pelvic physical therapists. So by providing the framework, if they are following all of that, there's no way that I can know if they're doing it right. But if they're using the mirror and they're following all of these things, and there's telehealth too. So I don't know if I would, that's another reason why I kind of say, this is not medical information for you. This is information to increase your awareness. And here's how to do it right. And here's some tips and things to I guess, be aware of that you may be doing it wrong. So.
And okay, I agree with you. There is some people that cannot find a physiotherapist. Even in Brazil, it's a huge country like US. There is places there that they cannot find a physiotherapist. And when they need to say, okay, I cannot do this by myself anymore. And I really need to see a physiotherapist because it's not working or I am the worst. So when they need to stop to do this without a physiotherapist?
Well, I don't have specific guidance on that. I would say if people are having pain, if people are having leakage, or if people are having prolapse, I want them to see a physical therapist.
But do you have some advice? It's like, if you're getting worse in 1 month, please stop do this, and you must see a physiotherapist, because sometimes if you do the wrong exercise, it can be worse.
Yeah, absolutely. The straining, yeah, it can weaken the pelvic floor. So I think that's a very individual and very specific question. If they're not doing the exercises correctly, or if they're having symptoms, I would definitely refer them back to their provider. Now, even though they may not have a pelvic physical therapist, there should be like their birth provider or a GYN or someone that they can go to help get help. So
yeah, sometimes I
definitely, if you're having symptoms or things are getting worse, definitely go see a provider, even if you can't find a pelvic physical therapist.
Yes, sometimes I believe gynecologists can help, because they need to make a vaginal examination. And so easy, they say, yes, you are contracting, this is correct. And
exactly.
This is what you need to do.
Yes,
and
exactly.
It's so simple. I always say to gynecologists, which I work with, please just tell them if they're the right way or not.
I know. It's good, and I think some gynecologists do that, but overall I would say they're worried about health and safety, right, and the organs and all of that. They're less concerned about the muscles, but more and more gynecologists are becoming aware and working with pelvic therapy. So I think that all of the information that's available worldwide is really helping that.
Yes, I started these talks with most of them who are gynecologists, physicians. And I can see the difference between now and 10, 15 years ago. They really understand it's necessary. Muscle is the base of the pelvis. So
yes, exactly.
Very happy now. They are more together with us. They are working together, and they are understanding why it's necessary to maintain these muscles health. So I have one question or more too.
Yeah.
And very interesting, because some women that had cesarean delivery think, okay, I'm very good, I don't need the therapist because it was cesarean. No, it's not. It's the pregnancy. It's not just the vaginal delivery.
Yes. And so also something that I see frequently with C-section is that the scar gets tight.
Yes.
And sometimes that can even make the bladder problems. So by mobilizing the scar and making it move better, that can help a lot of that.
Yep. And relax pelvic floor muscles. We say a lot, we need to contract, we need more force, but we need to relax these muscles. We have a lot of problem because we cannot relax.
Exactly. Yes. Like we're going around like this all day long. We've got to let go and open. So we have to do both. Absolutely.
Yeah. And we can have a urinary incontinence because they cannot relax. And that after they're so tight that cannot contract anymore. And it's funny, work on these areas since a long time. And 10, 15 years ago, we're just, you need to contract, you need to contract.
We've learned so much. We've learned so much. Yes, but it's so important to have both phases.
We all need to relax. So thank you so much for your time. You're amazing. You're so help what you do and explain. Everybody can understand a little bit better.
Thank you so much.
I believe it's my first physiotherapist speak English, so more who follow me can understand what you do.
Oh, that's great. Thank you for the opportunity.
No, I'm very happy to have you here. because I follow you, I believe, since you start, because we're so funny, so it's so amazing.
Thank you. Well, thank you so much for your support, and thank you for this opportunity to share, and we'll have to do it again on another topic sometime, because there's so much to share, right?
Yes,
so talk about.
Absolutely. We'll talk again and you'll share more. I really want to learn more with you. Thank you so much. And I will send you the link in my YouTube channel.
Good.
And you can see this after. Okay?
I love it. Thank you, Laira. So nice to meet you.
So much. Nice to meet you. Bye-bye.
Bye-bye.